We're going to talk today about pain. As you can see, we're going to some extent, be focusing on this idea of headaches, fibromyalgia, and back and neck pain, but also I'm going to be talking more broadly about the general concept of chronic pain. As we're going to be talking about today, chronic pain is, in many respects, this talk is almost more about a philosophical topic as much as it is about a real topic, and you'll understand that more as I go through it. That pain is a very subjective concept. We often spend a lot of time dealing with people thinking about what kind of pain they're in and how we feel about their pain. I'm going to assume from knowing people who come to these talks that I've got an audience here of people who represent the behavioral health care field, represent the nursing care field, represent the ancillary health care field, and kind of across a wide spectrum. And we're going to be talking today about medication treatment for pain, about physical medicine treatments for pain, and about psychological and behavioral treatments for pain. I'll say off the bat that as I am a psychologist, I'm going to talk about medication, I'm going to talk about physical therapy. I'm obviously not going to be proposing specific remedies for people for their pain in those areas, and we'll be doing more hands-on types of things with how we deal with pain from a psychological and behavioral point of view. There's another kind of pain that's often even harder to deal with, and that's what's called neuropathic pain, where there's damage to the nerves. So in neuropathic pain, you have pain that's been caused by a lesion or a disease to the nerve itself, or to the peripheral and or central nervous system, I should say. So the four different things that can cause neuropathic pain. You can have direct nerve damage. Things like a herniated disc where there's direct pressure onto a spinal nerve, or carpal tunnel where there's a direct encapsulation of nerves in the wrist. So in these cases, the nerves themselves at the peripheral level are being physically injured. You can have the automatic firing of damaged nerves. So these are peripheral nerves that are signaling that something is there even though nothing's there. Most common of these would be diabetic neuropathy pain or postherpetic neuralgia, which is shingles, where you have incredible burning and severe pain even though there's clearly no external physical manifestation. Nothing's actually happening at that spot. Deafferentation, where nerve has been removed, damaged, severed in some way. Things like phantom limb pain or spinal cord injury pain, where you're having pain in an arm that isn't there anymore, or you're having pain below the level of the severed spinal cord. And finally, sympathetically mediated pain. When we're in pain, there is as I said, there's a normal sympathetic nervous system response where we get increased heart rate, increased blood pressure. We have all the reactions of a fight and flight reaction. When we damage the sympathetic nervous system, and we damage nerves in particular ways, those nerves can become inflamed and can radiate through the nervous system, through the periphery, and create what we call reflex sympathetic dystrophy, or now often called complex regional pain syndrome. And this is a devastating condition in which people will develop an entire limb that will be chronically cold, clammy, discolored, intense amounts of pain are felt, and really often not responsive to a whole host of different medications. The thing about these kinds of pains is that they do not necessarily respond to many kinds of medicines. So most of the time, and we'll talk about this afternoon, narcotics do not provide any substantial relief for neuropathic pain conditions.